pain point, and one, 43, 46 is the wheelhouse for this rinse because those patients are not in that severe disease stage, right? So
Right.
that is a really great application. The pain point would be, how do I use this product up in 2 minutes or 2 weeks once it's mixed? That's what I get kind of out in the world when I'm talking about it. And like you said, there's so many versatile uses that that's where I help to educate dental offices on how they can implement the rinse, and not just the 43, 46 patients, but like you said, as a precursor to local injection. Absolutely. I just was on the phone today on a video call actually with a dentist in California, and she said, I loved it for when I had to do maxillary injections, because she said I do multiple, and I didn't, just like you, I didn't have to use topical anesthetic all over. The
Right.
patient swished and I could just go for it.